The mid-turbinate swab is performed by using one swab to swab each nostril consecutively. Now the swab does not go anywhere near as far as the nasopharyngeal swab, but it has to be done twice. So it's definitely a lot more tolerable, but then at the same time, you're getting two swabs. On the left, you can see that the mid-turbinate swab does not go nearly as deep as the nasopharyngeal swab. However, it is done twice. So some people will prefer the nasopharyngeal swab because it's only done once. And you can see it sits right under the inferior turbinate. And on the right, you'll see right here is about where you want to stop. So 2 centimeters in, and you can't really measure that just based off of the depth that you're going into the nair. So what I like to tell people is that it's going to be actually 3 to 4 centimeters if they look at the tip of their swab. If you're using a true mid-turbinate swab, they usually come with a cross-shaped stopper on the actual swab, and that's going to be your depth indicator. So you can use that to measure your depth. Once that cross-pieced indicator hits the outside of the nostril, that's as far as you need to go. But sometimes those aren't always available, so you can just use a nasopharyngeal swab. And one tip is you can just measure as if you're going to do a nasopharyngeal swab and just divide that by 3, and that's going to be your depth. Make sure you educate the patient about the procedure and possible discomforts. So open your swab, instruct the patient to lean their head back 70 degrees. Make sure you minimize contamination when removing the swab, and insert the swab approximately 2 centimeters, or as previously discussed, around 4 centimeters until you've reached the proper depth. Now again, the depth marker, if you have the right swab, is going to be on the physical swab, so you can use that to measure your depth. Again, you're going to be aiming towards the tragus or the earlobe as your direction. Twist 2 to 3 times and remove it with a steady motion. Place it in the other nostril and repeat the procedure. Make sure you're always talking to the patient about what you're doing so that they're expecting this next swab, because it has to be done twice. Tell them when the procedure is complete, place it in the medium, secure it, label it, and confirm the patient date of birth and name. Now, in a mid-turbinate swab, the deviated septum is really not that big of an impact when performing this swab. You can still perform the swab because it's not going in so deep. So if they say they have a deviated septum, just be aware that you can do the mid-turbinate swab. However, if they refuse it or they prefer not to have it done, that's okay. You can move on to the next swab or follow your procedures and guidelines specific to your situation. Again, we're going to be careful with previous ears, nose, or throat issues. Contraindications: nasal trauma, as talked about previously, any bloody nose, or any recent surgeries. This concludes the mid-turbinate portion, and we'll see you in the last swab, the anterior nasal swab.